ironically, one of the greatest hazards for future success is current success, because it makes sense to continue doing what works now. But if you're too comfortable to disrupt what works now, you risk not finding out what works better and why. My passion is helping organizations, governments, businesses, and individuals achieve impact through innovation. For the past 18 years, I've worked in the development sector. In plain English, this is the collective effort of organizations like the United Nations, the Red Cross, governments, and businesses to achieve the Sustainable Development Goals, to realize the human rights of every single person on the planet, no matter who they are. So this means eliminating poverty, hunger, and preventable disease, getting access to education, clean water, and a safe environment, and having peace, justice, and strong institutions. There have been impressive gains. Today, 17,000 fewer children will die than died every single day in 1990. But still, this year, 5 million children under 5 will never get to celebrate their 5th birthday. In sub-Saharan Africa, the proportion of primary school-aged children out of school has halved. But still, sub-Saharan Africa is home to the most children who do not get to go to school. And here in South Africa, the child support grant reaches almost 2/3 of every single child under 18 to level the playing fields for poor children. But still, this is the most unequal country in the world. So what's been achieved is good, but it's not good enough. And for the past 7 years, I've been involved in an effort to explore how innovation, technology, and a startup approach can disrupt development and achieve more with less. So, where to start? We wondered what kinds of innovative solutions could be designed if we shared the most pressing problems of the world's poorest people with creative minds with a track record of success. So, of course, we went to Silicon Valley. I spent a week, not with Elon Musk, but with 40 people who certainly share this perspective, successful entrepreneurs who've launched companies and made millions. But I soon realized that we were somehow on the wrong track, when after an entire week of co-creation, we ended up with solutions like subscription-based smartphone health apps that cost more to subscribe to than an entire day's income of a person who lives in poverty. Or water purifying systems that had to be delivered on giant trucks when they were supposed to be for remote communities that can only be accessible by footpaths. That is the moment when I realized that context is king, and we were missing it. Maybe we had the right approach, but we did not have all the right people in the room. And no amount of background and data and briefings can substitute for local perspective and local expertise. So we pivoted our approach to search for solutions in the places where challenges exist, to boost the problem-solving skills of people where those problems are, especially young people, and to connect into ecosystems so we could connect those entrepreneurs and those experts. My team has worked this way in over 85 countries, but today I want to share with you what we've learned from working closest to home in Southern and Eastern Africa. A 4-hour flight from here in Kigali, Rwanda, we identified a software company that understood that in a context of low connectivity and widespread poverty, SMS, or text messages, were so much more than just simplified and simplistic cell phone communication. These small messages could achieve big change. Together, we shared this idea that an SMS could be a driver, an engine to real-time big data. So with programmers and developers from across Africa, Nigeria, Mali, Senegal, Kenya, Malawi, Uganda, Rwanda, and South Africa, we built a solution that does just that. And we open sourced it, meaning that the software code is accessible to anyone, and anyone can add to it and build on it. and that could be used for non-commercial purposes. Today, that platform has delivered more than 1.5 billion life-saving messages. Messages sent by people like Pauline, who is a nursing officer in Uganda. She's one of 61,000 users in Uganda, and she uses that platform to register service problems in her community, to track life-saving medications, and also to be able to report on deadly diseases. Every single health facility in Uganda uses the same platform with impressive impact. In a country where 7% of children under 5 die from malaria, it is vital to understand where treatment medications are at all times. Because this platform has been able to inform that, Uganda has increased by 5-fold the availability of life-saving medication, from 15% to 79%. Knowing this information, they've also been able to almost, it's incredible and life-saving, and they've been able to achieve an almost doubling of the number of children who are immunized. So it's communities like this in which about 85 million people around the world have benefited in really similar ways. Health workers, mothers, children, and community members. But it's also in communities like this that people do not get to access simple diagnostic tests. This is for a couple of reasons. One is that the current tests are too costly, but more importantly, the tests currently use technology that is very sensitive to changes in humidity and in temperature, which means that they're very difficult to transport and also tricky to store. If you don't understand this context, the idea of focusing cutting-edge biotechnology research on reinventing the pregnancy test might not make sense. Here in South Africa, you can walk into a pharmacy and buy a pregnancy test for between $2.70 and $7. That is not affordable. There are 10.4 million people in this country who earn $1.90 a day. So that test costs much more than an entire day's income. This is why Rhodes University's Biotechnology Research Group has been focusing their efforts on developing completely new and revolutionary biological materials called aptamers. These aptamers are highly accurate, they're also less expensive to produce, and what's more, they are resistant to changes in environment, climate, temperature, so they can be stored and transported and be available in really remote areas. This is game-changing. The pregnancy test of the future is expected to cost half as much. It will be available to women in those marginalized and remote communities, not only because it's more affordable, but because it can be stored in those locations. What's more, it will be smarter. Not only will it tell you if you're pregnant, it will provide an estimate of how far the pregnancy is and flag up life-threatening conditions so that those women can be referred for further medical attention. This is not though, the only game-changing role that the Southern African Development Community, SADC, is playing in the world of innovating to save lives. In fact, SADC is the proving ground for understanding how drones work, how their imagery, transportation, and how they can be used to expand Wi-Fi networks and cellular networks over difficult terrain. In Malawi, they launched the world's first humanitarian drone testing corridor. And here you see community members in Kazuma getting first-hand contact with those drones that are going to be flown through their community. South Africa has launched legislation that tests and licenses commercial drone pilots, and Rwanda runs a nationwide drone delivery program. So SADC is the proving ground for understanding how drones can be used, but also the importance that context makes. For example, under certain circumstances, it is still more efficient to transport something on the back of a motorcycle than on a drone. But drones are already proving their value, especially in emergency preparedness, assessment, and response. Both Malawi and Uganda have used drones during flood situations because they can tell you the extent of the damage and, most importantly, how to reach affected communities. Drone imagery can deliver this in a matter of hours. Using traditional methods, this could take days because of downed communication infrastructure, washed away roads, and collapsed bridges. So while the world still continues to explore how drones can be used for good, one thing has become abundantly clear, and that is you cannot run a drone program without local capacity. And that's why these students from Malawi's University of Science and Technology are learning how to build and service drones, and so building skills for the 21st century. And it's students, children, young people that are among Africa's richest resources. Our continent has the world's youngest population, so empowering them and investing in their capabilities to be problem solvers, social innovators, entrepreneurs, is actually an investment in our collective future. Young people like 17-year-old Rajia in Mozambique are already creating their own network effect. These young people, you reporters, are connected, 6 million of them, across 53 countries. And they're harnessing technology to close information gaps and to amplify their opinions. They've used innovative platforms to connect to leaders, to share what youth needs are, and to understand the context that young people find themselves in, so that no decision about them is made without them. Experience is an honest teacher, and I've learned from scaling and adopting and adapting innovations across 85 countries that one thing is true: context is king. And I think one of those people who inspires me most is the man that this event commemorates, Nelson Mandela, who said that vision without action is just a dream. Action without vision just passes the time. But action and vision, that can change the world. And if you understand the context of your world, that is the most critical factor. Because for innovation to work, it must work in context. And when it does, we can achieve tremendous impact. If you understand the context, even penguins can fly. All of us are the experts in our own context, which means that all of us can be the most powerful architects of solutions to the challenges we face. And doing that, we can change our world. Thank you.